The anterior abdominal wall is a multi-layered structure and it is hexagonal in outline. Let's look at in this model. We are looking at the xiphoid process at the top, and on the sides we can see these costal margins, and these are my lower ribs with their costal cartilages. And when we move down, there we can see the lateral boundary, and down at the bottom here we can see the iliac crest. Then we have the inguinal ligament, and then we have the pubic tubercle, and this is how this hexagonal shape come in existence. So now let's start labeling it. So we can start from the xiphoid process, and then we go to the costal margin, and they are making the lateral boundaries, and then they are approaching to what? The mid-axillary line, which exists between the axillary margin and the iliac crest. An inferior boundary. For the inferior boundary, we can see there is iliac crest, and then it reaches to my anterior superior iliac spine, and beyond that we had the inguinal ligament, and then if we can go down, we will reach to the pubic tubercle, pubic crest, and in the midline we have the symphysis pubis. So this is how this multi-layered structure completes its journey. The anterior abdominal wall. This anterior abdominal wall is primarily made up of muscles, and these muscles are arranged in layers, and these muscles are named according to their direction of fibers, and most of them are organized obliquely, transversely, and vertically. The first muscle, which is coming obliquely downwards, that is my external oblique. You can see that it is interdigitating with my serratus anterior muscle, and then this muscle is coming down all the way close to my anterior superior iliac spine, and beyond that it becomes aponeurotic, because my anterior abdominal wall is not very thick, and this aponeurotic part is being descending down, and here is attached to my anterior superior iliac spine, and there it goes to the pubic tubercle, and this lower rolled in part of my external oblique muscle, it's making my inguinal ligament, and this muscle meets with its counterpart on the opposite side to complete this first wrap of my external oblique anteriorly. Now look at it. On this side of the model, external oblique muscle is not shown. So you can see that all the digitation of my serratus anterior. External oblique is not visible in the picture, but now you can see another muscle layer that is below to my external oblique, and the fibers are going in an opposite direction. They are going upwards. External oblique, they were coming downwards, and they were crossing each other at 90 degree. And this muscle which is ascending upwards, that is my internal oblique muscle. And when we remove this, then only we can see transversus abdominis muscle, which is not possible to show you on this model. In a common term, we always heard about six packs. What is the six packs? Can you see these transversely going interdigitations? These are once someone is spending time in workouts, so these tendons become apparent because the fat dissociates from my anterior abdominal wall, and then person will proudly show to you his six packs, and primarily you can see there's a muscle which is going vertically, and this is a straight muscle, and we have learned before. This anything straight is rectus, and this is rectus abdominis. Now this rectus abdominis is enclosed by my external oblique, internal oblique, and transversus abdominis. Differently, they envelop this muscle, and this arrangement, this organization is different at different levels that we will be covering when we will be talking about the organization of the rectus sheath. Now, if we look at into this real cadaveric image, the skin has been removed here and you can see the muscle layer. So after the removal of the skin, what we should expect, there is a fairy layer, and this layer is also known as the Camper's fascia, and below to that we had a membranous layer that is also famous with the name of Scarpa's fascia. And below to that, like you can see in this image, this is known as a musculo-epineurotic plane of anterior abdominal wall, and this is a wrap of muscle. Our whole trunk is being wrapped in layer of muscles, and these muscles are named in the thoracic cavity differently, and in the abdominal cavity they are named differently. They are named according to the direction of their fibers. And if you can see that the directional fiber, they are running obliquely downwards, they are converging, and there you can see in the upper part there is the fleshy part, and then it becomes aponeurotic. What is aponeurosis? Aponeurosis is a flattened tendon sheath. The whole purpose of this flattened tendon sheath is just to give strength, and it is very thin, so minimize the thickness, and it is as strong as the muscle. And when we approach down, we can see the internal oblique, the directional fibers, they will be going upwards, and inside we had the muscle, their direction is they are running transversely, and that is named as the transversus abdominis muscle. And if you can pay attention, you can see here under this aponeurotic sheet, you can see these two vertically going muscle, and these are very strong muscle, and as their direction is the fibers are going straight, so we call them the rectus abdominis muscle. And these rectus abdominis muscle, they are extending from the top, from the lower ribs and the xiphoid process, and bottom to the pubic symphysis and adjoining area. And if you can pay attention, in the middle of this you can see this white line, a very strong structure, and this white line above the umbilicus is thick and very strong, but below the umbilicus it's just a simple strip and it becomes symbolic. The main thickness is above that. So now let's look at, this is what my hexagon was. So this is exactly the shape of my anterior abdominal wall. So now these three muscle wraps, what are those wraps? The external oblique, the internal oblique, and the transversus abdominis muscle. They wrap around this rectus abdominis muscle, and this wrapping is given at a pattern. But before we go further, let me share with you, can you see these transversely going lines? These are the tendinous arcs, and if someone is very muscular, the fat dissociate, and then someone will talk of his six packs. And if you pay attention, these lines, they are not seen below the umbilicus. So the first level is just at the level of umbilicus. The third level is just at the xiphoid process, and the second is in between. But rarely you'll find below the umbilicus the presence of these tendinous arc or this transversely going fibers. Now, as I was saying before, this rectus abdominis muscle is enclosed by the aponeurotic sheets of my external oblique, internal oblique, and transversus abdominis. Then let's put it here, but before going to those details, let's look at it in my anterior abdominal wall, how the superficial veins has been organized in our body. In the upper part of my body, you are looking at the axillary veins. They are shown, and we all know these axillary veins are joining, after joining the internal jugular vein, they are making the brachiocephalic veins, and the brachiocephalic veins makes my superior vena cava, and that drains into the right atrium of the heart. So now these axillary veins, what you can see here, they are receiving the lateral thoracic veins and the other superficial pair of veins. So they are running above the umbilicus and they are draining into these axillary vein. And below the lower part, below the umbilicus, the veins are draining, and these are the superficial epigastric veins, and they are opening where? Into my long saphenous veins. And these long saphenous veins, we all know, they are connected with the femoral vein. So this is how the superficial veins under the skin, the subcutaneous superficial vein, this is their organization. If we go further, now let's look at the arteries first. How and what happens? So now what are we looking at? We are looking at the subclavian arteries. Subclavian artery are coming from my abdominal aorta. On the right side, we have a brachiocephalic trunk which divides into right subclavian and right common carotid. And on the left side, we have direct subclavian artery. This subclavian artery, we are not talking about it at the moment, but it gives a very important branch, and that branch is known as the internal thoracic artery. And this branch of my subclavian artery, it runs in the anterior thoracic wall, and it has very strong contribution for the supply within the intercostal space, and is coming down all the way. And then when it reaches at little lower level, it bifurcates, it gives a branch, and that branch of my internal thoracic, we call it musculophrenic, and then itself it continues as my superior epigastric artery. So in other words, subclavian artery, it gives an internal thoracic artery, and this internal thoracic artery, then it divides into superior epigastric and musculophrenic artery. Don't forget, this internal thoracic artery, which was in older time was known as internal mammary artery, this artery is also used when someone is going for cardiac bypass surgery. So this vessel is also used for controlling, for supplying once we are doing that CABG surgery. So internal thoracic artery are also being utilized, and there are certain units and certain departments, those who are using it. Now this is the arrangement above. Now below, what happens? From the external iliac, we have these inferior epigastric arteries, and they are running upwards. Now this superior epigastric artery and the inferior epigastric artery, they are running in my rectus sheath. And what is the rectus sheath? Is an aponeurotic layer of three muscles: external oblique, internal oblique, transversus abdominis muscle. And then they are wrapping around my rectus abdominis muscle, and these arteries are running within that sheath, and they provide a collateral channel. And with this organization, we have established an arterial communication, and in certain condition, if there is some blockade, some failure, these arteries can do little role, and they can provide in just a role. They are helpful in providing a collateral channel of blood circulation. Now let's look at the lymphatic organization. So above to umbilicus, the lymphatic is going upwards, and that is draining where? Into my axillary lymph nodes. And below to the umbilicus, it is being directed where? To my superficial inguinal nodes. So this is the organization. Where are we looking at? We are looking at the superficial organization. And then going down, now this is my rectus abdominis muscle. We can see from a side view, and in front of it we have the aponeurosis. But like we have talked about, I have discussed with you that this muscle is wrapped between the aponeurosis of these oblique muscles. So this is the anterior part of that, and we call it anterior wall of my rectus sheath. And there we can see the posterior wall of the rectus sheath. But this posterior wall is not as long as my anterior wall. What is that? So let's look in this business later. And then just behind that, we have the fascia transversalis. And just behind that, we have the extraperitoneal fat. Now, there you are looking at superior and inferior epigastric vessels, and we have discussed about them, that what are their sources and from where they are coming. Guys, this rectus sheath is a real important landmark, and we need to know about it. So now there you can see there is a line which runs transversely, in an arc fashion, and this line is my arcuate line. Now the same person, and we have talked about all this. So what we do, we just make a transverse section. We use a reference point, let's say anterior superior iliac spine. Anterior superior iliac spine externally, and internally we'll use the arcuate line as a reference point, and we can cut it at this level, a transverse section. So the transverse section, if we are looking at a transverse section which is located above to my anterior superior iliac spine, so there we can see in this section my rectus abdominis muscle, they will appear like this, and then on the sides you can see that there are three muscles which are present on both the sides anterolaterally, and you are looking at what are these. Let's label them. These are my external oblique, internal oblique, and transversus abdominis. Now we learn that these muscles become aponeurotic. So let's trace the external oblique. So the aponeurotic part of my external oblique, it goes and it crosses in front of my rectus abdominis muscle. See what happens to my internal oblique. Internal oblique muscle wraps around. When it reaches this rectus abdominis muscle, it splits and it wraps and then joins. And then the last one, my transversus abdominis, that is going behind. My external oblique is going in front along with the internal oblique, and then my transversus abdominis and the posterior splitted part of my internal oblique, they are going behind my rectus abdominis muscle. And then this we are looking at, this orange line is representative of fascia transversalis. So now what do we have? We have the anterior wall of the rectus sheath. We have seen, you can confirm it here. This section is at this level. So we can see this blue line, and that blue line is basically this anterior rectus sheath. So this is my anterior rectus sheath. And then where is my posterior rectus sheath? So you can see very clearly we have the posterior rectus sheath. So this organization where we can find, if we can see above to this dotted line, so we can see this type of organization. And obviously where we can find those inferior epigastric vessels, they will be, because we saw that they are entering inside this rectus sheath, so they will be located posterior to my rectus abdominis muscle in both of the sides. Now let's look at below this dotted line, and let's see the organization. What we will see here, same rectus abdominis muscle, but what happened? All these aponeurotic parts of my external oblique, internal oblique, and transversus abdominis, they all have gone in front of these rectus abdominis muscle. So as a result, and there is my, what is that? Fascia transversalis. So we only have anterior rectus sheath. So if we can look at in a transverse section above to my anterior superior iliac spine, we can see the anterior rectus sheath, as well as we will be seeing a posterior rectus sheath. But below to the anterior superior iliac spine, the situation is different, and then there is no posterior rectus sheath. And this is applicable when we are doing surgery and when we are closing abdomen. So below to the anterior superior iliac spine, we will not find the posterior rectus sheath. So only we are suturing the anterior rectus sheath. Before going into the description, first let's have the orientation of this cadaver. This is the upper part of the body, and this is the lower part of the body. This is right side and that is the left side. And this is where you are looking at the umbilicus, and this is the epigastric region, and this is the suprapubic region. And this you are looking at in the middle is the midline. The skin and the superficial fascia have been removed. And now you are looking at, very carefully, pay attention. Can you see these obliquely going muscle fibers on both the sides? This is the outermost wrap of anterior abdominal wall, and this muscular wrap is arranged obliquely, and this muscle is known as the external oblique muscle. Now we can see the anterior abdominal wall from the inner aspect. And you can see here the arcuate line. And this is my rectus abdominis muscle. You can see these directional fibers of this innermost wrap of my muscle on both the sides. This is my transversus abdominal muscle, and you can see that above to this arcuate line, it is going behind. This is you're looking at the posterior rectus sheath, because they are covering they are going posterior to my rectus abdominis muscle on both the sides. And then if you can pay attention, you can see very clearly the inferior epigastric vessels. They are shown on both the sides, and this is where they are entering into this rectus sheath just posterior to my rectus abdominis muscle. Okay, let's summarize. In the anterior abdominal wall, we have talked about. So now we can highlight, we can see from the front, and then we'll review from the back. So now here what are we looking at? On the side we can see this external oblique muscle, and we can see that it becomes aponeurotic. And there it's been going in front, we have seen this already. And this muscle which has been hidden, but you can see its highlights, that is my rectus abdominis muscle. And this obliquely going fibers, the externalmost wrap, that is my external oblique muscle. And there you can see in the midline this very thick strong band, that is my linea alba. And then on the side, the other side, the external oblique and its aponeurosis has been removed. And now you can see the rectus abdominis muscle which has been exposed. It's not been covered by any of the aponeurotic part. And there we can see we have talked about these three tendinous intersections, and I have mentioned to you below to the umbilicus we don't find them. And this straight muscle, you can see that is coming from the ribs above, and it's going to the pubic symphysis below and the adjoining area. That's my rectus abdominis. And then on this side we can see this fibers which are ascending up and few fibers which are arching downwards. This is my internal oblique muscle, and these fibers which are arching downwards, they contribute in making the conjoint tendon along with my transversus abdominis muscle. In this model, I cannot show you the transversus abdominis muscle, but I can use the other side, the flip side of this model, and there we can see now from the inner aspect. So there, let's start recapping the thing. So now you can see, can you notice 1, 2 and 3 wraps? So this innermost fibers, and on the organization of these directions, so that tells me this is a transversely located muscle, and this is my transversus abdominis. And you can see that this muscle makes the posterior rectus sheath, but there's a landmark. This is an arc-shaped structure, and we call it arcuate line. So above to the arcuate line, the posterior rectus sheath is covering my rectus abdominis muscle, but below to this arcuate line we don't see any posterior rectus sheath. So we are looking at what? We are looking at the transversus abdominis muscle is posterior covering. Fascia transversalis I cannot show you on this model, but you must be familiarized with this arcuate line, and this is the location through which we have the entry of my inferior epigastric vessel. They enter into my rectus sheath through this channel. Thank you very much.